And a good morning, everybody. Welcome to JoJo the Caregiver Show. If you like the information, please remember to like, share, and subscribe. And today I thought I would talk to you a little bit about home management. A lot of my PSW students get their first job working inside of someone's home. So this is usually done through a healthcare agency. So the agency would hire the PSW to go into your client's home to perform a specific list of duties. These duties are worked out beforehand between the case manager and the client's family. And then they're going to give you a job description of the tasks that you have to do. Very important for you guys to get that list of tasks because you want to stay within your scope of practice as a PSW. You don't want to be doing tasks that are outside your scope of practice. So always know the tasks they expect you to perform while you're inside of the client's home. The actual definition for tasks that PSWs perform in the home are light housekeeping, healthcare related tasks. So light housekeeping, we're talking about what? Dusting, mopping, vacuuming. You're not supposed to be like shoveling snow off your client's driveway. You're not supposed to be planting a garden for your client. Both of those requests were done for me as a PSW, so I had to deal with those requests. And you always want to go to your supervisor if you get requests that you think are outside your scope of practice. You don't want to get in a power struggle with your client. So try to go to your supervisor, the case manager in this case, to work that out. So some of the tasks that you guys may also be asked to perform would be handling your client's money, which is very important for you guys to always back yourselves up. You keep your receipts. And if it's cash, you're going to give back the change to your client, keep the receipts as well. These are some of the tasks that we call instrumental activities of daily living, a little more complex things that you may be required to do for your client. Assisting with medications would be another one. Making meals for your client for the whole day and leaving them in the fridge. Those would all be more complex things you would do. They fall under the scope of instrumental activities of daily living. So when you first start inside your client's home, you're probably going to have to get used to the routine. All PSWs develop their own routine over the course of a few weeks, but you're also keeping in mind prioritization. You want to do the important things first. Being flexible, your client may need, for example, they may need to use the washroom quickly, so you're going to have to stop what you're doing, help your client with those types of things. Priorities should always come first. And I think you should focus on one task and then move on to the next. A lot of PSWs try to multitask, so they do many tasks fairly well instead of doing one task excellent and then moving on to the next task and doing an excellent job with that. So I think it's much better to kind of focus on one task at a time. If you're being asked to make your own cleaning solutions, because sometimes you have clients that are kind of on a fixed income, they don't have enough money to pay for some of the brand name cleaning products. So you might find yourself in a situation where you have to make your own disinfectants. So sometimes vinegar can be a very good disinfectant, which is 1 part vinegar, 3 parts water, and you can use that as a disinfectant or to clean your client's mirrors, windows, that type of thing. The other big one is bleach. Everybody seems to have bleach and like to use bleach as a disinfectant, but you have to get the combination correct because bleach is very strong. So the combination is 1 part bleach, 10 cups of water. So at least 10 cups of water with the bleach. And bleach is very good to clean the toilet, the floors. You cannot put bleach inside of the toilet though because it mixes with ammonia that we find in our client's urine, for example. That can actually cause a poisonous gas. So we want to avoid putting bleach into the toilet and using it more outside the toilet on the washroom floors, that type of thing. The other one that people generally don't think about is baking soda. Baking soda is an excellent product to remove stains. And that combination is 1 part baking soda, 3 parts water. You can clean counter stains. You have to rub counters very gently, though, so you don't scratch them. Also, clothing. You can take stains out of clothing, which is another job you're going to have to do as a PSW inside the home. If your client does have a stain on their clothing, you want to kind of take it carefully to the laundry area, double bag it if you have to, and soak the stain in cold water first. This breaks up the proteins. And then you can kind of soak it in a solution of laundry soap, or some people even use the dishwashing soap. They soak it for like another 15 minutes in that. Then you can kind of throw it into the washing machine, or you can kind of soak it in cold water again for another 15 minutes. And that's something you'll get used to as a routine if your client is staining their clothes. Urine, feces, and blood stains can all be handled in that manner. Okay, so doing laundry is something your client will be very particular about, or even some clients, they may not be as concerned about laundry, but you're trying to meet the client's needs. You're following the instructions carefully. They might ask you to do whites as one load, color clothes as another load. You're supposed to follow specific laundry instructions. You can find them on the clothing tags, or you can actually find them these days on the actual washing machine door, dryer or washer door. Will have different directions on washing and drying clothes. Okay, so sometimes when you're inside your client's home, you have to do chores maybe you don't want to do, such as taking out the garbage, cleaning toilets, cleaning sinks, those types of things. But it is part of your client's environment. The environment is very important to keep it clean for your client. Less chance for infection, less risk of your client getting a respiratory illness if you're keeping their home environment as clean as possible, right? So again, if your client asks you to do something that maybe is outside your scope of practice, you want to kind of stay calm, respectful, and try to work it out with your client if you can. If not, you're going to have to go to your supervisor to kind of get a ruling on whether or not you should be doing that task for your client. Okay, I hope that was helpful, and I'll see you guys next time on JoJo the Caregiving Show.